Hi, I'm Dr. Katherine Harris. If you clicked on this video because you're worried about finishing too fast, I want you to take a slow breath with me right now. In through your nose, hold for a second, and out through your mouth. Good. You're not broken, you're not alone, and you absolutely can retrain your body and your brain so you feel more control, more confidence, and more pleasure. Today, I'm going to guide you through a practical, step-by-step exercise program to help you stop premature ejaculation. It's science-based, it's gentle, and it's something you can start tonight, at home, without special equipment. Think of this as athletic training for your intimate nervous system. We'll build awareness, we'll strengthen the right muscles, we'll relax the ones that keep you too tense, and we'll rehearse a reliable routine you can repeat in real life. Before we train, let's make sure we're talking about the same thing. Premature ejaculation means you climax sooner than you want to, often within seconds to a minute or before penetration, and the key part is that it creates distress for you or your partner. Some people notice it only in certain situations: new partner, high stress, little sleep, too much caffeine, or after a long break from intimacy. For others, it happens consistently. There are two big contributors we'll address: a hair trigger arousal reflex in the body and performance anxiety thoughts in the mind. The exercise you're going to learn calms the reflex and quiets the loop of anxious thoughts at the same time. You're going to learn your personal arousal curve, you'll discover your point of no return, and, most importantly, you'll build a reliable early warning system so you can slow down before a climax is inevitable. Here's the heart of the program. I call it the 5-part control exercise: breathe, map, anchor, edge, and reset. It's a simple routine that you'll practice alone first, then with a partner if you have one. The first part is breathe. Most people who finish faster than they want are breathing high and shallow without realizing it. That breathing pattern ramps up your sympathetic nervous system, the same system that fires during a sprint. Instead, we want a calm but alert body that can feel pleasure without tipping into a reflex. Place a hand on your lower belly and one on your chest. Inhale through your nose for 4 counts so your lower hand rises first. Hold for 1. Then exhale through your mouth for 6 counts and feel your belly soften. Do that 10 times. Keep your jaw loose and your shoulders heavy. If you hear your exhale, that's good. Think of it as steam leaving a valve. This is not just relaxation. It's a direct dial you can turn to lower arousal pressure. The second part is map. Your pelvic floor, the sling of muscles you use to stop urine midstream, is deeply involved in orgasm. Many people with rapid climax have a tight, overactive pelvic floor that's on all the time, like a clenched fist. We need both strength and the ability to release. Lying down or sitting comfortably, find the pubococcygeus or PC muscle by gently contracting like you would to stop urine. Hold that tiny squeeze for 2 seconds and release for 4. Notice the difference between clenching your abs or glutes versus the subtle lift inside the pelvis. Do 5 gentle reps. Then practice the opposite: a reverse Kegel, which is like the feeling of starting urine flow or bearing down a little. Try a soft expansion for 2 seconds, then return to neutral for 4. Do 5 gentle reps. You're learning your gas and your brake. Right now, we care more about the brake, release, than the gas. Throughout the rest of the training, you'll use a micro-release to drop arousal just enough to keep going without losing your erection. The third part is anchor. Choose one physical cue that you'll use every time you feel your arousal rising too fast. It could be pressing your tongue softly to the roof of your mouth while you exhale, relaxing your forehead and jaw, or placing your thumb lightly against your index finger and noticing the exact texture of your skin. Pick one and keep it consistent. Your anchor is like a bookmark for your nervous system. Whenever you apply it, your body starts a learned response: slower breathing, softer pelvic floor, calmer mind. Over the next few weeks, you're going to condition that response the way athletes condition a movement pattern. The fourth part is edge. Edging means approaching high arousal and then backing off before the point of no return. It's the core of retraining. Start with solo practice. Use a small amount of lubricant, choose a comfortable position, and keep your shoulders and hips relaxed. Bring yourself to medium arousal. Let's call that a 6 out of 10. At any moment, if you feel yourself climbing quickly toward an 8 or 9, apply your anchor, long exhale, jaw soft, reverse Kegel release, slow your rhythm, and pause if needed for 10 to 15 seconds. Let the wave fall to a 4 or 5. Then continue. Do this in cycles for 10 to 15 minutes, 2 or 3 times per week. If you climax early in a session, no problem. You didn't fail. You just learned where your limit is today. Write down what you felt right before it happened. Tight breath in the chest, pelvic tension, speed increase, intrusive thought. This is data, and data helps you improve. The fifth part is reset. After each edge cycle, give your body 30 seconds to settle. Shake out your hands and feet, let your belly soften, and take 2 or 3 longer exhales. Then begin the next cycle. The reset prevents your arousal from ratcheting up with each round and keeps your training smooth instead of frantic. Now let me knit those pieces into a 4-week plan you can follow. Week 1 is about groundwork, breathing, mapping, and awareness. Week 2 introduces structured edging with a timer. Week 3 adds the gentle squeeze method and a quicker, early warning response. Week 4 bridges to partnered practice and real-life situations. Week 1, every day, do your 10 slow breaths with the belly hand. After that, do 5 gentle Kegels and 5 gentle reverse Kegels. Keep it effortless. No straining, no holding your breath, no big movements. Then, spend 5 minutes learning your arousal scale without any goal to climax. 0 is no arousal, 10 is just beyond the point of no return. Where is a calm 3? Where does a 6 begin in your body? What sensations tell you that you're at 7? Most people have very clear signals once they look for them. A sudden tightness low in the pelvis, a feeling of pulling upward, breath holding, a particular thought like, please don't happen now. Your job is to notice earlier. It's much easier to slow down at a 6 than at an 8. End each session by jotting 3 notes. What helped, what made it worse, and what you'll try next time. In week 2, you'll add structured edging sets. Set a 12-minute timer. For the first minute, just breathe and relax your jaw and shoulders. For minutes 2 through 11, do 3-minute cycles. Build to a 6 or 7 over about a minute. Apply your anchor and a reverse Kegel to let the wave fall to a 4 or 5, then repeat. If you start climbing fast, pause for 10 to 20 seconds and breathe out slowly until the heat drops. In the final minute, cool down with soft strokes or no stimulation while you breathe. Aim for 2 or 3 of these sessions per week. This structure gives you repetitions, and repetitions build control. Week 3 adds a classic tool that still helps many people when used gently and correctly, the squeeze. The goal is not to crush sensation, it's to interrupt the reflex arc. As you approach a 7 or 8, place a gentle, steady squeeze at the base just below the head for 5 to 10 seconds, or apply a light pressure to the underside near the ridge where sensation feels most urgent. Do not squeeze hard enough to hurt or cause numbness. Combine the squeeze with your long exhale and a reverse Kegel, then release and let arousal drop. Think of it like tapping the brakes, not slamming them. In week 3, also add a standing practice for the pelvic floor. While you brush your teeth or shower, exhale and feel the pelvic floor soften. Then inhale and feel it return to neutral. 2 minutes a day is plenty. Many people with rapid climax have never practiced letting the pelvic floor off. That ability to release is your secret weapon. By week 4, we bridge to partnered practice, if you have a willing partner. If you don't, stay with solo training for another few weeks. There's no rush. With a partner, agree on a simple traffic light system. Green means continue, yellow means slow or pause, red means stop and reset. Starting clothed or partially clothed, spend 5 to 10 minutes on full body touch with no focus on genitals. This is sensate focus. You're learning to feel pleasure everywhere, so all the pressure doesn't land in one place. Keep breathing, keep your jaw soft, and practice your anchor whenever you notice a climb. Next, introduce hand stimulation with the same start-stop rules you used alone. When your body hits a 7, say yellow, exhale, soften the pelvic floor, and pause until you're back at a 4 or 5. That's one cycle. Do 3 to 5 cycles, then stop for the day. Later, you can add oral stimulation or penetration if desired, using the same yellow cues and same resets. You're building a shared rhythm where control and connection replace panic and pressure. Let's talk about the point of no return. This is the moment when ejaculation is inevitable. Your job is not to hover forever right at that line. Your job is to recognize the early signs of the slope that leads to it and steer away sooner. Pay attention to sequence. For many people, it goes like this. Pleasurable tension builds, breath gets shallow, pelvic floor tightens upward, a mental "oh no" appears, then a quick rush of heat, and then it's too late. Your earliest reliable sign might be breath change or a subtle lift inside the pelvis. That's when you use your anchor. The earlier you respond, the less dramatic your interruption needs to be. Eventually, your body will learn that pleasure can rise and fall without high stakes, and the reflex quiets. Anxiety is the twin engine that drives loss of control. What if I finish too fast? What will they think? I have to perform. If those thoughts sound familiar, you're in common company. We don't fight thoughts with more thoughts. We change our relationship to them. Try this cognitive shift during your practice. When a worry pops up, label it out loud or in your mind. I'm having the thought that I might finish too fast. That phrase, I'm having the thought that, creates space. Pair it with a slow exhale. Let the thought pass like a cloud instead of chasing it. Then ask your body one question. What number am I right now? Bring attention back to sensation and your scale. If you fall into a spiral, pause your session, shake out your hands, stretch your hip flexors for 30 seconds, and begin again. We're training patterns, not perfection. Let me give you an example of a full session so you know how it looks. You wash your hands, set a 12-minute timer, and choose a quiet, private place. For the first 60 seconds, you sit or stand with a hand on your belly and breathe. Your jaw hangs soft. Then you begin gentle stimulation, letting arousal rise slowly toward a 6. You notice your breath starting to catch. That's your cue. You anchor. Long exhale, reverse Kegel, slow your rhythm. The wave falls to a 4. You continue. At minute 6, you rise toward a 7. You apply a light squeeze for 7 seconds, exhale, and pause until you're back to a 5. At minute 8, your mind says, don't mess this up. You label it. I'm having the thought that I could mess this up, and you return attention to your body. You finish with a cool-down minute of breathing and soft touch. Then you jot 3 quick notes in your phone. Breath helped, squeeze needed only once, mind spiral at minute 8, labeling worked. That's it. Consistency beats intensity. If your goal is to last longer during penetration specifically, add 2 bridge drills. The first is the rhythm drill. Use a metronome app or count in your head. 3 slow movements, 1 pause. Each movement lasts about 1 second. On the pause, you exhale and soften the pelvic floor. Repeat this pattern for 3 minutes during solo practice. Then, when you're with a partner, use the same 3 and pause rhythm for a minute or 2 at a time. The second is the pressure drill. Many people drive too much tension through the abs, glutes, and legs. That feeds the reflex. Practice switching between 3 zones. 1. Soft belly and soft glutes, your default. 2. Light belly tone with glutes soft, for stability. And 3. Brief glute tone with belly soft, for position changes. Feel the difference. When arousal spikes, return to zone 1. Soft belly, soft glutes, long exhale. Let's address a few common triggers and how to handle them. If porn has trained you to a very fast, intense stimulation pattern, your nervous system might be expecting a sprint. During this program, Reduce or pause porn and emphasize slower, more varied sensation. If you do use visual material, choose content that encourages pacing and full-body arousal rather than fast-focused intensity. If you're sensitive to certain positions or types of friction, play with lubrication options. More glide lowers overstimulation. If condoms change your sensation significantly, experiment with different textures and thicknesses, and put the condom on early in your warm-up so your body treats it as normal. If you notice you climax much faster after several days of no activity, train more consistently with shorter sessions rather than long gaps followed by a long session. If caffeine and stress accelerate everything, shift your training to times you feel calmer. Many people do best in the evening after a shower and light meal. What about strengthening the pelvic floor? You'll hear a lot about Kegels as a cure-all. Kegels can help if you have a weak pelvic floor, but many people with rapid climax are already too tight. That's why, in this program, release is trained first. If you do strength work, keep it balanced. 1 or 2 sets of 5 gentle contractions where the exhale is longer than the contraction, and always follow with a longer release. If you feel pressure, pain, or a sense of pulling up that doesn't let go, cut back and emphasize reverse Kegels and breathing. Pelvic pain, burning, or urinary symptoms deserve a medical evaluation. A pelvic floor physical therapist is a wonderful ally. Now let's fold in your partner more fully. Connection lowers pressure. Before intimacy, agree on 2 things. You're going to play with start-stop together, and there's no pass-fail tonight. Begin with full-body touch. Narrate the scale out loud sometimes. That's a 5. That's a 6. I'm going to pause for a breath. Many partners find this intimate and reassuring. Use the traffic light language. Yellow to slow or pause, green to continue. When you say yellow, pair it with a long exhale and a pelvic release. Your partner can rest their hand gently over your lower belly while you exhale. That tactile cue reminds your body to soften. Celebrate small wins. 1 extra minute, 1 smooth reset, 1 moment where anxiety was replaced by a smile. Those wins compound. I want to talk about mindset, because skills grow best in a friendly environment. Performance is not your identity. You are learning a coordination, like learning to play a musical instrument. Some days the notes flow, some days your fingers fumble, and both days count as practice. Be curious instead of critical. Swap, "Did I last long enough?" for, "What did I learn about my early signals today?" Swap, "I have to be perfect" for, "I get to practice." And please remember, climax is not the enemy. Ejaculation is a natural, healthy part of sexual function. You're not trying to avoid it forever. You're learning to place it where you want it, or to separate orgasm from ejaculation at times if that's interesting to you. That flexibility is real, and it grows with the same skills you're building here: breath, release, pacing, and attention. Let me give you a compact checklist you can screenshot or memorize as your routine. Before, hydrate a little, empty your bladder, take a warm shower if you like, and do 10 slow breaths with a soft jaw. During, build gradually, keep your tongue resting on the roof of your mouth, use your 3 and pause rhythm, exhale whenever you feel a climb, soften the pelvic floor, change angle or depth rather than speed if you need a reset. After, cool down with a minute of breathing, note what worked, and thank your body for learning. That minute of aftercare consolidates progress. Sometimes premature ejaculation is secondary to other factors: prostatitis, thyroid issues, medication side effects, alcohol or nicotine use, low sleep, or pain. If you notice burning, pain, blood, urinary changes, or a sudden change in your pattern, I encourage you to see a clinician for a checkup. If you're on medications that affect arousal, discuss options with your prescriber. If you struggle with erectile firmness and rapid climax at the same time, your plan still works. Calm breath and pacing help both. But a medical evaluation is wise. None of what I'm sharing is a substitute for individualized medical advice. It's general education and training to help you build control. Let's return to the 5-part control exercise and embed it into your day so it becomes automatic. Morning. 3 minutes of breathing and pelvic release while you sit at the edge of your bed. Afternoon, a 60-second micro reset when stress hits. Exhale, soften the jaw, soften the pelvic floor, drop your shoulders. Evening, your 12-minute structured edging session 2 or 3 nights a week. On off days, do a 5-minute awareness session. Close your eyes, breathe, and imagine the start-stop rhythm. Feel the release on the exhale, and see yourself pausing calmly at a 7 and letting it fall to a 4. Visualization primes your nervous system the same way athletes rehearse race starts. A quick word on pleasure. Expanding where you feel pleasure makes control easier. If 95% of your sensation is focused in one tiny zone, your system will tip quickly. So cultivate full-body arousal. Explore erotic touch that includes neck, chest, back, hips, inner thighs, feet. Let your partner massage your shoulders while you breathe. The more places your body associates with intimacy, the less pressure falls on a single trigger point. Sensation variety is a training tool, not just a bonus. If you want a simple way to measure progress without obsessing over minutes, try the cycle count. A cycle is any moment during stimulation when you say yellow, apply your anchor, and let the wave fall. In week 1, you might manage 1 or 2 cycles before climax. By week 3, you might be doing 3 to 5 cycles. In partnered practice, celebrate each successful cycle more than the final time. Those cycles are your reps, and reps build mastery. Let's also normalize breaks. You are allowed to pause during intimacy and still be loving and present. You can kiss, breathe, change positions, or laugh. Pauses are part of sex. When you treat pauses as skillful choices rather than failures, your anxiety drops and your control rises. Over time, you'll need fewer and shorter pauses because your early warning system will kick in automatically. I want to talk briefly about separating orgasm from ejaculation because some of you are curious. It's an advanced skill, and it rests on the same foundations you're building: breath, pelvic release, and pacing. As you approach high arousal, maintaining a soft jaw and a released pelvic floor while allowing rhythmic whole-body pleasure can lead to orgasmic waves without the ejaculatory reflex. This is not a requirement, not a test, and not something to force. If you explore it, do so very gently and always stop if you feel discomfort. The focus of this video is control, not chasing special states, but know that the skills you're learning open many possibilities. Now, because I care about your safety and long-term health, here are red flags that mean you should seek care in person. Pain with climax, pain lasting after intimacy, burning with urination, discharge, fever, blood in semen or urine, numbness or tingling in the pelvic area, or a sudden onset of rapid climax after an injury or new medication. Also, if your distress is intense, panic, depression, relationship crisis, please talk to a clinician or therapist. Combining this training with counseling for anxiety or perfectionism is powerful. Let me offer 2 short, real-world scripts you can use with a partner. First, before intimacy. I want to try something that helps me feel more in control and helps us enjoy more. If I say yellow, it just means I'm pausing to breathe for a moment. It's not a bad sign. It's us practicing together. During intimacy, yellow, okay, 1 breath, jaw soft, back to green. That's it. Simple language lowers pressure and keeps both of you on the same team. If you like having a plan, here's a sample week. Monday, 12-minute solo edging, write 3 notes after. Tuesday, 3 minutes of breath and pelvic release, no stimulation. Wednesday, 12-minute solo edging with 1 squeeze drill, note your cycles. Thursday, off, just 2 micro resets during the day when stress hits. Friday, partnered sensate focus for 10 minutes with traffic light words, no goal. Saturday, 12-minute solo edging or partnered start-stop, whichever fits. Sunday, off, stretch your hip flexors and take a walk. That's sustainable and effective. If you miss a day, you didn't break anything. Pick up where you left off. A lot of people ask, How long until I see change? In my clinic, most people who practice consistently notice a meaningful shift in 2 to 4 weeks. A calmer mind, a clearer early warning signal, and 1 or 2 extra cycles before climax. Over 2 to 3 months, many develop stable control that carries into different positions and settings. Your timeline is your own. Stay with the process. Let's do a mini practice together right now. Sit comfortably. Inhale through your nose for 4 counts. Exhale through your mouth for 6. Again, 4 in, 6 out. Relax your jaw. Imagine the pelvic floor like a hammock. On the exhale, feel the hammock soften and widen. Place your thumb lightly against your index finger. That's your anchor. And notice the texture. Let your shoulders drop. Now say quietly to yourself, I can slow down. I can feel and choose. Good. That's the state you'll return to each time you feel a fast climb. The more you rehearse this state, the easier control becomes. I'll close with this encouragement. Control is not the opposite of pleasure. Control is what allows pleasure to last. You're not fighting your body, you're learning your body. Every time you pause and breathe, every time you release the pelvic floor and feel the waves settle, you're rewriting a reflex that might have been tight for years. Your nervous system is plastic. It learns, and you've started teaching it tonight. If this was helpful, save the video so you can follow the routine again during your next practice. Share it with someone who might need a gentle, practical guide. And if you want a deeper dive, I can create a full audio practice you can listen to with timed cues for the breathing, the anchor, and the start-stop cycles. Let me know in the comments what part of the training you want more help with. The breath, the pelvic release, the squeeze technique, or the partner communication. I read your messages and I'm here to help. And I'm Dr. Catherine Harris. You're doing better than you think. Take one more slow breath with me. Inhale for 4, exhale for 6. Soften the jaw, soften the pelvic floor. You've got this.